Welcome to this tutorial on ultrasonography of the canine medial and caudal thigh muscles. My name is Dr. Elodie Uge, and this project was developed in collaboration with Dr. Jennifer Repack from the University of Florida's Integrative Medicine and Mobility Service. We have no conflicts of interest to disclose. In this tutorial, we will briefly review medial and caudal thigh anatomy and demonstrate how to evaluate the Gracilis, Semimembranosus, and Semitendinosus muscles using ultrasound. These muscles are especially important because of their involvement in dogs affected by fibrotic myopathy. Fibrotic myopathy involves replacement of normal muscle tissue with fibrotic tissue, resulting in muscle contracture and loss of elasticity. It is most commonly reported in German Shepherd dogs. Clinically, affected dogs show shortened stride and characteristic gait changes, including medial paw rotation, external rotation of the hock, and internal rotation of the stifle during the swing phase. To perform a medial and caudal thigh ultrasound examination, the patient should be sedated and placed in dorsal recompency. The air over the scanning region should be clipped. Ultrasound gel and alcohol improves acoustic contact, and a high-frequency linear probe, typically between 8 and 18 MHz, is recommended. Before scanning, several ultrasound settings should be optimized. Depth should be adjusted so the region of interest fills most of the screen and can be increased or decreased as appropriate. Next, the focal point should be adjusted to the mid to deepest portion of the structure being imaged, as it is the narrowest part of the ultrasound beam and the point of highest resolution within the image. Overall gain controls the brightness of the entire image, while time gain compensation allows adjustment of brightness at different depths within the image. The major muscles of the canine caudal and caudal medial thigh includes the biceps femoris, semitendinosus, semimembranosus, and gracilis muscles. The semimembranosus and semitendinosus are hamstrings muscles, whereas the gracilis is an adductor muscle. In this tutorial, we will focus specifically on the gracilis, semimembranosus, and semitendinous muscles, which are commonly evaluated in dogs with suspected fibrotic myopathy. Next, we will demonstrate how to identify and evaluate each of these muscles using ultrasound. Starting in a transverse plane, the transducer is placed over the medial thigh region to isolate the flat and wide gracilis muscle. The semimembranosus muscle lies caudal and deep to the gracilis muscle. Sliding the probe further caudally allows the semitendinous muscle to be identified. All muscles should be imaged in both transverse and longitudinal planes. Starting with the gracilis, the muscle is traced proximally to a short tendon of origin on the pubic symphysis. It is then followed distally, where its wide and flat tendon can be seen coming into view at the caudal aspect of the muscle belly. The gracilis tendon further flattens at insertion on the tibia between the sartorius and semitendinosus muscle. The origin, body, and insertion are then imaged in a longitudinal plane to highlight the parallel hypoechoic muscle bundles and tendon fibers. In a transverse plane, from the mid-body of the gracilis muscle, the semimembranosus muscle can be found by sliding the probe caudally. It is a larger and broader muscle and is traced here to its origin on the ischiatic tuberosity. The semimembranosus is then traced distally, where its cranial and caudal heads can be best distinguished. The semimembranosus is traced to insertion on the medial aspect of the distal femur and medial tibial condyle. Sliding the probe further caudally, the semitendinosus muscle is identified. It can be differentiated by its rounded margin and slightly more hyperechoic appearance when compared with the other medial and caudal thigh muscles. In a transverse plane, the semitendinosus is traced to its origin on the ischiatic tuberosity, and then followed along its entire length to its insertion on the medial tibia. A portion of the semitendinosus also inserts on the tuber calcanei via the common calcanean tendon.